Well, you're laughing right now, aren't you, if you work construction in Queensland? But many frontline workers are ropeable about the sweet deal. Kara Thomas is president of the Nurses Professional Association. Kara, you're probably wishing you worked construction right now. How do you feel about their perks?
Well, we've got nurses in Queensland working in crisis conditions. We've seen nationally the health crisis that's going on. We've got patients waiting on waiting lists. We've got emergency wait times blowing out, and we can barely get pay rises that are keeping with inflation and cost of living. It's just, these are nurses that are highly trained professionals that are literally saving lives, running down corridors with bleeding out patients, doing CPR, running emergency departments and ICUs, and people are getting huge perks for driving what is most of us drive to work and then we pay for our own parking.
That's it. I mean, when you look at the list of perks, it's pretty extraordinary, and I just feel it's a real kick in the guts to you guys. As you just said, like, we know how understaffed and overworked our nurses are. What message does it send to your members and to all frontline workers?
They're giving out these ridiculous perks to construction workers while we've got perinatal mortality rates that have been reported as doubling in the last 4 years. They're closing down rural maternity facilities. We've got 75,000 nurses that have left the profession since the beginning of COVID. That's 1 in 5, and partly because they're not paid enough.
Did you feel like this is basically saying that they don't care about you, that you're being ignored?
Well, where's the investment? I mean, where is the restructure? We literally have people dying. We have nurses leaving in droves, and the investment's going into people getting perks that are almost what we earn in an entire week because they have to drive 50 k's to work.
Well, let's just look at that, right? Because, and look, can I just say too, I mean, good luck if you're a construction worker. Nothing on you, but it hardly seems fair. There's an extra $1,000 a week if you live more than 50 k's from the job. I think about how often nurses end up, say, working double shifts and then having to drive home tired. If anyone deserves a kickback for travel, it's you.
Yeah, well, so many of our members are talking about how they're doing overtime, how they're working double shifts because of the staffing shortages, because of the skill mix problems. And if you've worked a double shift and then you've got to drive home, it's really hard going.
One of the things that got my attention, that they won't work when it's 29 degrees and humid. I keep thinking, imagine if the air conditioning unit was to break down in an emergency ward and you all walked off the job.
Well, you can't, because people's lives literally depend on you. We just literally worked through a pandemic where for a period of time masks were behind lock and key because there wasn't enough PPE.
You're fired up about this, aren't you?
I'm really upset because our staff, they work so very hard, literally saving lives, and we want to do the very best we can for our patients. And our members are burning out and they love their job, and we want to provide the very best care we possibly can to our patients. And they're spending money on above 29 degrees and 50k travel, while we've got people, our patients, literally dying, waiting because we're on bed block and bypass. This is insane. Babies are dying and the government's giving money for a standard travel for most people.
Well, then how do you feel about the Queensland Premier's response today? So Steven Miles said, and I quote, "Our nurses, our teachers, our ambos have some of the best conditions in the country." What do you make of that, and what's your message to him?
Well, maybe he should come and work a day where he's running down a corridor while somebody's bleeding out, or trying to do CPR in an ambulance because you can't get anyone into emergency, or work a double shift and not have a mask during a pandemic, and be on a wage where you're struggling to keep up with cost of living and inflation. I mean, it's okay to say that, but the reality is that there needs to be serious investment and serious restructure, because it's been reported they're increasing administrators more than they are increasing frontline staff. There needs to be a restructure and a reinvestment.
Well, look, I really hope the Premier's listening. We love and we appreciate our nurses, Kara, and we appreciate your time too. Thank you.
Thank you so much.